So you've suffered a dislocation of the kneecap, or the kneecap has moved out and gone back into position. Should you have any surgery, or can this be managed conservatively? There are many factors in this. If this is the first time your kneecap is dislocated and the scan does not show major damage to the bones, then it's likely that you'll do very well with the combination of physiotherapy and perhaps a knee brace. However, if your kneecap keeps dislocating, you've had physiotherapy and you're significantly affected by it, both in terms of your function or due to pain, then surgery may be more effective in stabilizing the kneecap and improving your symptoms. So you've been recommended or are thinking about surgery for kneecap stabilization. There are several surgical options, and it's really important that your specialist considers the whole of you and what's actually wrong with your kneecap before recommending one or a combination of these options. So I'll go through the three main options. This is a right knee, and most kneecaps dislocate outwards or laterally. So this right kneecap is likely to have dislocated this way. The scans and the clinical assessment should give us the idea as to why the kneecap has dislocated. There are three main factors. The first is a lasso or a sling that's known as the medial patellofemoral ligament, and that lives on the inside, the medial aspect of the kneecap, and it's almost like the reins of a horse that are stopping the horse from bolting. If you have recurrent instability of the kneecap and the kneecap keeps dislocating, that ligament can either not heal or healed in a stretched position and not be effective. So one of the operations can be to reconstruct the medial patellofemoral ligament. The other reason the kneecap may be dislocating is that it's sitting in a very shallow groove, or it may be sitting very high above the groove. If the groove is shallow, you may still not need an operation to break and reset the bones, but if it is very, very shallow or actually dome shape, an operation to break and reset this bone and to push it down is known as a trochleoplasty. So effectively, we're recreating the groove that the kneecap sits in. The final operation is because the kneecap tendon is actually pointing in the wrong direction. So this is a right knee and you're looking from the front. If the insertion of the kneecap tendon is what we call lateral, a bit like that, then the pull of the tendon and the quadriceps will tend to make the kneecap dislocate. So if this insertion is too far lateral, then what you can do is slice the bone and move the insertion medially, and sometimes also it can move downwards so that the kneecap sits further in the groove. That is known as a tibial tubercle transfer. Now you can do a combination of these operations. Each one of them has a risk profile and it has an effectiveness. And it's really important for the surgeon to tease out which or combination of which operations is the best one for you. The final operation is not actually at the kneecap itself, it's at the thigh bone, because sometimes the thigh bone can be rotated the wrong way. And I'm not going to talk about this in this particular video, but it's another consideration that your surgeon should be considering.